The broadcast is now starting. All attendees are in listen-only mode.
Good morning. We'll get started in about 2 minutes. We're just letting a couple more folks log in. Good morning, everyone. Today is Tuesday, April 4th, 2023. I'm Christy Culbreth, the DDA's statewide coordinator of self-directed services. We welcome you to the DDA's self-directed services webinar regarding support broker vendor billing. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. If you look in the panel interface on your right, there is a section labeled audio. You can click on the computer or phone to switch for your best option. We have two handouts in the platform today, and they are in the handout section. We are recording this webinar today, and it will be posted on the DDA website and YouTube page soon. Our webinar today is targeted at support brokers, but we're happy to have everyone on the call. We will have time for questions at the end, so please put your questions in the question box. Today I'm joined by Rhonda Workman, the Director of Federal Programs and Integrity. She will be facilitating our question and answer portion. Today we'll be focusing on support broker billing. We'll first go through a quick overview of the support broker service and how it can be delivered to people. Next, we'll review updates on how support broker vendors should be invoicing. I'll share an example of an invoice in these slides. Next, I'll review some useful resources for support brokers and everyone who is involved in self-direction. And then we'll have a quick note regarding the DDA's waiver renewals. And finally, we'll have time for questions. Let's start with an overview of the support broker service. First, support brokers are an optional service in the Community Pathways, Community Supports, and Family Supports waivers. Support brokers provide employer-related information and assistance regarding self-direction to support people to make informed decisions about their day-to-day management of their service and budget. Support brokers can also assist with developing employee policies, procedures, schedules, vendor and provider agreements, and emergency and backup plans. Finally, support brokers can be active members of the person's team, helping to create the person-centered plan and budget with them. Support brokers are required to meet all qualifications and requirements at the time they serve participants. They must hold an active support broker certificate by attending the DDA certification or recertification training and passing the support broker exam. They must also hold active first aid and CPR certificates. and they have to have a cleared background check. People self-directing may also require additional qualifications or training outside of what is required in the waivers. Support brokers in Maryland can either be employees or vendors. Support broker employees are hired directly by people they work for. They complete all new hire paperwork that is provided by the person's Financial Management and Counseling Service Agency, or FMCS. Their wages are chosen by the person who is self-directing. Support broker employees complete timesheets biweekly on the schedule of the FMCS agency and are paid out on the FMCS payroll calendar, and taxes are withheld from their paychecks as appropriate. Support broker vendors contract their services to people they work for. They complete all necessary paperwork for the participant's FMCS, always including a W-9 tax form. Their rates are negotiated by the support broker and the person self-directing. And support broker vendors issue invoices and are paid without taxes being withheld. Today, we'll be focusing on support broker vendor invoicing. During the Maryland Department of Health FMCS transition, the way FMCS agencies bill the system for all service hours provided to participants was updated. The fee-for-service model requires that the FMCS bill the department for all services delivered. The FMCS needs key information to process an invoice. For example, the date the service was delivered and the number of service hours provided. To be paid, support broker vendor invoices are required to have the following: the names of the person and the support broker, the days in which the support broker services were provided, the times in which support broker services were provided, the total hours and amount charged, and the signature of the support broker. All support broker invoices must be approved by the participant in order to be paid. Now let's review a sample invoice. Here we have a header. You'll see we have the person who is self-directing listed as J. Doe. Then we see the support broker listed as K. Smith. Finally, we see that they are invoicing for the month of April 2023. Now we'll look at some example entries from this invoice. First, we see that on April 3rd, the support broker met with Jay to discuss onboarding for 2 hours. Then the next day, the support broker drafted a recruitment plan and called Jay to review. These tasks took 1 hour each. Then on April 10th, the support broker supported Jay to screen candidates for 2 hours. And on the 15th of April, supported with interviews for 3 hours. Finally, we see that on April 18th, the support broker supported Jay and their new employee to complete new hire paperwork for 1 hour. April's total of support broker hours adds up to 10 hours. The support broker vendor takes those 10 hours and multiplies it by the rate that they charge per hour. Now remember, that rate is negotiated between the person and the support broker. In this case, that is $65 an hour. Then the support broker signs the invoice. In order for the invoice to be paid, the person self-directing must now approve the invoice and submit it to their FMCS agency. Now, let's review some resources that are available for support brokers and any other person in self-direction. I want to take a few minutes to note that our DDA website has so many useful tools. We have a self-direction specific landing page that has so much information on self-direction. It also has all of the forms needed to complete in self-direction. Next, we have an FMCS specific landing page. Here you'll find all the information you need regarding the FMCS. You'll see links to the agency's websites, the FMCS fee schedule and payroll calendars, and all of our guidance on the transition. We also have our DDA YouTube page. I love doing webinars like this with you all. Being able to hear your questions live and answer them is so useful. But if you're unable to attend a webinar or you need to be refreshed, please check out the DDA YouTube page. Finally, we have all three websites for our FMCS agencies here. They are filled with information that is specific to each agency. If you have any questions for the DDA, please do not hesitate to contact us. I have included my email here, as well as the email from my colleagues in each of the regional offices. Our SDS leads in the regional offices are on the ground every day, supporting people to self-direct, and are just an excellent resource. If you need to connect with someone at any of our FMCS agencies, we've included their contact information in the following slides. Here is the contact information for GT Independence. Their main contact person is now Raquel Barber, and her email and phone number are listed here. For the ARC, their contact person is Karen Bradbury, with her information here. And for PPL, their contact person is Chantel Talley, with her information here. Finally, I want to take a few minutes to address the DDA's waiver renewals. The DDA's waiver renewal will be effective July 1st, 2023. The renewals did include the requirements of the Self-Directed Services Act of 2022, which had many updates for support brokers. When the renewal is approved, the DDA will issue additional guidance regarding support broker services and billing. That was a quick bit of information, so I'm now going to turn it over to Rhonda Workman to facilitate any questions we may have had.
Thank you, Christy. Thank you for sharing information today about support broker invoicing. We do have a few questions to go through. The first question relates to the attachments. Can you remind our participants how they could access the handouts and the attachments?
Definitely. In the panel on your screen, you'll see a tab labeled Handouts, and it will say 2 out of 5, and there should be 2 downloadable PDFs there. One is our slide deck for today, and the other is a sample invoice. We'll also have these available on the DDA's website.
Thank you.
Soon.
So our first question is, does the support broker need to obtain the participant's approval signature prior to sending the invoice to the FMCS?
That's a good question. So I want to be clear. In order for the FMCS to pay an invoice, the person or their designated representative must approve the invoice. You can do that in two ways. The FMCSs do have a mechanism for vendors to send invoices directly to them, and they will get the approval from the person. That does take more time, we're seeing. You can also send your invoice directly to the person and they can approve it and send it to their FMCS. But I think what would not be appropriate would be support brokers submitting their own already approved invoices. There's a conflict of interest there. So I hope that answers your question.
Thank you, Christy. The next question or comment relates to monthly invoices, and support broker services prior to the public health emergency really were limited to 4 hours per month. But we know with the public health emergency, there's more flexibility, right, to provide additional hours. Can you speak to that a little bit and talk about, if there's any differences on how you would invoice if you exceeded that 4-hour allotment?
Definitely. So I think the first thing is you always want to make sure we're following our flexibilities. So for currently, our Appendix K flexibility is support brokers can bill up to 20 hours per month, as long as they stay within a person's budget. So people do need to ensure that if they're going over what they budgeted initially for support broker, that they're moving funding to that line item.
Great. The next comment is a suggestion, a recommendation for the FMCS to acknowledge receipt of a message with specific information associated maybe with an invoice for support brokers and such to help ensure that messages and information is received. Can you talk about maybe the participant as the employer of record, maybe some of the strategies they can do in terms of supporting or acknowledging their employees and vendors in terms of invoices and processing?
That is great. Yep. So I would say that what is important is that each of these FMCSs are on an agreed upon timeline for payment with the person. So participants, if they have turned in an approved invoice to their FMCS and the time has lapsed where past the date that payment should have been made, the person needs to connect with their FMCS or someone who supports the person to connect with their FMCS to ensure payment. Yep. I hope that answers the question.
Yeah, and the next comment is another suggestion maybe for the FMCSs to provide a response within so many business days if an invoice has a problem, right? If they can't process it further. Can you talk about your understanding and who would be alerted if there's issues with invoice or timesheets that the FMCS cannot process?
Yeah, it is our understanding that FMCSs would let the employer or the participant know if payment cannot be made. If that is not the case, please have people and their team should be reaching out to the FMCS if payment has not been made. We can also alert the FMCS program manager, Monica Hariri, to ensure that that alert is happening to the person.
Great. The next question is will the support broker timesheet for the ARC of Central Chesapeake still be required? Can you talk a little bit about timesheets versus invoicing?
Yep, I think this question is asking about the support broker checklist. So I'll say a few things. So I think we want to be clear that there are two different ways to get paid as a support broker. The first is as an employee, where you would submit a timesheet biweekly, very similarly to how direct support professionals submit a timesheet electronically to the person with their FMCS app or with the phone system that PPL has. So there's that way to get paid as a support broker. Otherwise, support brokers should be issuing an invoice with the details that we laid out today. there is no need to complete that checklist. It's quite outdated and doesn't provide the detail that the FMCS need anyway. So I hope that answers the question.
Thank you, Christy. Today you shared an example, right? Not a required template, but an example of an invoice. And the next question is related to that. So they say for the sample invoice, there is some language that says payment is due within 30 days. And the question is this from the date of service, date received by the FMCS, date participant approved, or others? Can you share your thoughts on the, again, example that we had shared?
Definitely. From my perspective, that would be a business decision, what that 30 days means. It also does not need to be 30 days. As a vendor, as your own small business, you can decide when the turnaround that you expect from the people that you work for as far as payment goes. What is important and what we believe is best practice is that expectation is clear on the front end with the participant and their team and the support broker. So however you would like to require payment to be due for your invoices is up to you. That is a business decision.
Thank you, Christy. Our next question is there an official process to have the invoice approved by the participant?
No. The participant can, there's, like I mentioned earlier in the questions, there are a couple ways to have an invoice approved. The first is to submit it, vendor to submit that invoice directly to the FMCS, and they would seek approval from the person, or you can get approval from the person directly.
Great. The next question is what are the increments of time that can be billed? If we do a task for 5 minutes, can we round up to a quarter hour? For this one, I just want to remind everybody that in the DDA policy stat, so on the DDA website, we have a link at the top banner that refers to policy stat. It's where we have our existing issued policies. Under our administrative policies, there is a policy related to billing in increments, include 15-minute increments. And for that, in order to bill for 15 minutes of services, you would have to minimally provide 8 minutes. So I'll just refer to that. And then Christy, if there's anything else you would like to add to that.
I do. Currently, the support broker billing documentation requires increments of 1 hour, but I've suggested before that best practice would be on the quarter hour, and I believe a lot of participants, a lot of families feel great when support brokers bill as tightly and closely as possible to that quarter hour.
Okay. The next question or comment says, for the example, it does not take into consideration slides 10 to 13 for responses to phone calls, texts, and emails, which take place and take less than 1 hour and cover multiple participants within a short period of time. Can you talk about best practices and strategies when you're supporting multiple people as a support broker in terms of tracking your activities and times?
Oh, definitely. So what I would say, right, is it's really important that you're billing for one person at a time, that you're working for one person at a time. So there are many strategies to do this, and we can go into detail at a later date. But for me personally, as a former support broker, what I found the most useful was to keep account of my entire day and count the number of minutes I worked for each person I worked for, and adding them up by the end of the day to the quarter hour and billing that way. That ensured that I was not duplicative in my services to people, so I wasn't billing for 2 people at once. And it also ensured that I wasn't underbilling, so I wasn't working without being paid, and I wasn't overbilling either, right? Both of those are a concern for us. We want support brokers to be paid for exactly the hours that they're working. So my suggestion is to try to keep account of your day-to-day every day. I know that sounds tedious, but fundamentally, I think most support brokers will actually bill more accurately in their favor, meaning they'll actually be billing for all the work that they're providing if they do it that way.
Thank you, Christy.
Mm-hmm.
So the next question relates to initial fees, right? And in the DDA operated programs, there is initial orientation and information supports that can be provided when someone's starting self-direction. This person is noting they've been told to not put dates on the invoice prior to the effective date, even though that was when they were working with the initial plan and orientation. And so they're looking at any clarification information we can give regarding initial fees and how they should be processed for orientation and such completed before the plan is approved. Can you share a little bit about the upcoming updates to the FMCS related guidance in terms of people doing initial orientation supports, even for people who have not been enrolled in the program yet, and whether they should be invoicing?
Definitely. So in our, we are very soon to issue an update to our FMCS program guidance, which will include some details on support broker startup, which would be the services, the initial orientation, and information that support brokers provide to people before they begin self-direction. And that would mean that they would be getting support broker services before their effective date into self-direction. So it would definitely be appropriate and important to include the dates on those invoices. I'm not sure the guidance that you got regarding not including those dates, but you would want to, because we would want to see that that initial orientation came before the effective date of their self-directed journey. So we want to make sure those dates are there, and we'll have, in that updated guidance, there will be a significant amount of detail on support broker startup.
Thank you.
Mm-hmm.
Next question, can a support broker vendor invoice biweekly?
Definitely. That would also be a business decision, and it's up to the support broker and the people they support. I do believe monthly tends to be the best practice because the frequency works for most people, but you can.
Great. The next question notes that for each FMCS, they have different processes for submitting vendor invoices. We need to submit invoices to participants, and the participants will send to their FMCS, question mark?
Yeah, I think that is a great way to do it. I think if you're submitting it to the person, they have time to review, and then they have full control over submitting it for payment. But again, you can also submit it directly to the FMCS, and they will seek approval from the person. I will say that we have seen that has caused delay in payments, having the FMCS reach out to the person for approval.
Okay. Person's noting the ARC asked the support broker to send their invoices to an email address, and so does GTI. Another person is looking for the handouts. Again, if you look on your screen, the right panel, there will be a section that says handouts. It'll have a 2 on it. If you click on that, it can open up and you'll see 2 documents you can download. We're happy to also forward it to you if you want to send us an email afterwards. And as Christy said, they will be posted to the DDA website. Next comment says there have been instances where FMCSs will require their own vendor payment form, but they are not required for all participants. Should we be doing the vendor payment form and an invoice? Mm-hmm. Christy, can you talk about your information and background and whether this may be a current practice or a previous practice?
This is a previous practice, and I think it also might be a current one, and that's okay. So I think what is important is each FMCS is required to ensure that participants or the people who support them approve an invoice. So some FMCSs may be using a paper form to ensure that approval, and that is okay. I believe that might just be the ARC who is doing that, but I can follow up with Monica on that, and we can look into streamlining that process so it is easier for participants in the future.
Thank you. Next question. Does the support broker need to submit a vendor agreement with the PCP? Who should they be sharing that with?
You can. So vendor agreements are not required documentation, but we believe that they are great best practice. It is really important for vendors, especially for vendors and participants to have an agreement on what services will be provided. It's best to do that in a written way. If you do have a vendor agreement that is written for people you support, it would be excellent to include that in the PCP, but they are not required. It is important to note that if a participant is using a support broker as a support in the participant agreement, as like an option 3, so if the support broker is being listed as supporting a person with certain tasks, that does need to be completed and included in the PCP. So I just want to distinguish between vendor agreement, which would be a written agreement between the provider, the vendor, the contractor, and the person, and the participant agreement, which is a agreement between the DDA and the person on how they will be supported. The latter being required. Mm-hmm.
So today you were sharing some information about support broker vendor invoicing and noting that there are really some key data elements that are now required, right? The data services and the number of hours. Can you share when this requirement start? When should they start doing these invoicing with these key data points?
From my perspective, each FMCS has been required to receive that documentation in order to make the payment as of January 1st, 2023. So we issued some guidance in a communication earlier this year, noting that you could send in that documentation directly to the FMCS for invoices already submitted. But going forward, these details are required in order for payment to be rendered.
Thank you. Mm-hmm. Next question. Do participants have to have a support broker?
Not at this time. Yep. We'll talk more when our waiver renewal is approved and what that might mean for certain people.
Right. So right now under the waiver, it's an optional service. And as Christy's noting with the waiver renewal, there will be some additional requirements for certain types of people that are providing supports to participants. Our next question comment says, could the support broker obtain the participant's signature and then submit it? Relying on a family member to send the invoice could delay payment by several weeks based on how the FMCSs are currently paying out vendors and invoices. Can you talk a little bit about that and that participant agreement where people can also have identified other team members to support them in some of these actions?
Definitely. So just quickly, I understand more than a lot of people how difficult it is to get a signature and get that invoice in to get paid. However, we want to avoid conflicts of interest at all costs. And for us, we believe that a support broker should not be submitting a signed and approved invoice for their own services. So there are a couple of ways to support people. The first is you can submit that invoice directly to the FMCS and they can support you, or they can support the person to get it approved. Or you can use that participant agreement and they can identify someone who will quickly approve invoices so that payments aren't delayed. Or my favorite, we can make sure that people are supported to understand how to submit invoices on time and quickly. I will note that all the FMCSs do have a commitment to their timeline for as soon as an invoice is submitted, the FMCS will pay an invoice either on a weekly or bi-weekly basis. So PPL and the ARC both have, if you submit an invoice that's approved and correct on a Wednesday, the vendor should be paid the following Friday. And for GT, if you submit an invoice that is approved and correct on a Monday of payroll, it's paid on the following Friday, just like on the payroll calendar. So there shouldn't be delayed payment. It should be quicker. It should be at least bi-weekly that vendors are being paid. And we can Yeah.
Thank you.
Mhm.
So we've had some questions and related to invoicing frequency, and we talked about, monthly seems to be kind of a standard practice from what we've seen in the history of the program. And one person asked, well, could I bill biweekly? And we said, sure, just we work out that arrangement with the participant. Now a person is asking, would quarterly also be appropriate in terms of billing for support broker services?
No, I monthly would be the longest a support broker should be waiting to bill.
Great.
Just to support people.
The next question relates to access to FMCS systems to support people in terms of monitoring their budgets and making sure that they're in line and not overspending. Can you talk about your understanding about access for support brokers and CCSs to information to support people?
Definitely. It is my understanding that each FMCS is working on a real fix to the situation where support brokers do not have their own access to the person's budget and the portal as the person desires them to have. However, in the meantime, it would be expected that if a person needs support to review the budget and the portal, that support brokers are meeting with people and their teams to walk alongside them to use their access. I would expect support brokers to be meeting either virtually or in person, side by side at a computer to review that monthly budget and to review that the portal as needed.
Thank you. So a couple questions, and we're just going through. So some of these we've kind of touched on, but does the participant have to sign the actual invoice? Our sample invoice does have an option for signature there. Another person wants to know, where can we find an invoice template? It's one of the handouts that's noted, and we'll also post it on the website with this webinar. Next question.
I think maybe to underline this, a signature on an invoice from the participant or their designated representative is an appropriate form of approval. I think maybe that's to underline that.
Okay. Another question about when these requirements would be effective. Christy's already shared, this should begin in January. We've also recently issued guidance that said if you did not provide those key elements, that you could submit them to the FMCS, and then going forward, make sure you incorporate them in your invoice. Just looking at that's relevant to our question. We're getting some questions about Appendix K and the renewal that we will be discussing in our April 21st webinar. We hope you can join us there. This person says, regarding the questions about the checklist, currently I am submitting an invoice from me as well as a vendor request form, but the information seems redundant. Is it possible to only have to submit my invoice or receipt if the participant's signature is on my invoice? Does the signature have to be on payment?
Yeah, from my perspective, that would be appropriate. We can go back to the FMCSs, but a signature on an invoice seems like plenty approval to me.
Yeah, and we know that some of the FMCSs allow invoices to be uploaded in their systems, but the FMCS will not pay on that unless the participant authorizes it. So they may be doing that electronically within the system.
We want to allow for the FMCS's requirement to ensure approval by the person. So I want to be careful that it's their responsibility to ensure the person has approved it. And so they may go to the person and ask, they may ask for a form. We want to allow them that capacity.
Okay. There was a person that is having some questions related to, do other vendors have to only bill for one person at a time? It sounds like this person is associated maybe with an agency or organization that has multiple support brokers. They say, am I hearing that I cannot have two separate employees, I'm thinking support brokers, work on two separate participants at the same time. Can you clarify what we were talking about?
Well, I mean, that would be fine. So for what is important is that one support broker is only working for one participant at a time. That is what is important. And so you'll see on the requirements for invoices, it does require the specific support broker to be listed. Is that's our expectation, is that one support broker will be working for one person at a time.
Great.
Mm-hmm.
The next question says, what happens when the funding in the budget does not support the number of hours the employer uses and there are no unallocated funds? Can you talk about that person-centered planning process, the importance of staying and looking at the budget and activities and actions that should be taken prior to completely exhausting those?
Definitely. So I would first say that the flexibility of self-direction is great, right? I think everyone on this call and everyone who is involved in self-direction in Maryland understands how important that flexibility is. And it would include that budget authority to be able to move funding throughout line items within some parameters that the DDA shares. So during a planning process, if a team knows that they might need additional support broker hours, it is appropriate for them to think and to prioritize what services they need. So from our perspective, additional support broker hours could come and should come from the fully loaded brick. This maybe is not helpful, but should come from services that are approved within the service authorization already. So if someone needs additional support broker hours, it's appropriate for the person and the team to consider how they might find cost savings in their budget elsewhere. I hope that answers the question.
Great.
Mm-hmm.
Couple questions about the invoice and the sample invoice where we've got activities listed. Can you talk about why activities would be important to list on the invoice?
Definitely. Support broker services are a waiver service, and it is important to note what service is happening. Additionally, it's a great service to participants. They can really see and understand and have that authority to manage the service that they're being provided.
Great. There's a question about certain documents and whether they would be accepted by the FMCS, like DocuSign, Excel, etc. Can you talk about best practices related to signatures?
Mm-hmm. So I want to be careful to say first that the FMCS is responsible to ensure that the person has authorized it. And so we want to be careful that that is happening and that that the person is actually authorizing the invoice. That is best practice. And so that could be electronic signature if the person has the ability or has the support to do so. It could be a written signature should the person have the ability or support to do so. But we want to be very clear that the person or their designated representative should be the person signing. I hope that answers that question.
Yeah.
Mm-hmm.
The next question is, will DDA provide access to LTSS for support brokers to bill? The answer would be no, because all self-directed services are billed through the FMCS. They're not billed through LTSS. Question, Christy.
Rhonda, do you want to mention my LTSS just to clarify? That's different, but.
No, I think we'll just stick with that at this time.
Okay.
Yeah. Can you share with people what they should do if their invoice is not being paid?
What a support broker should do if their invoices are not being paid is they should go to the participant, the person they work for, and express that they have not been paid. If invoices have not been paid, participants and their teams should go to their FMCS. If for some reason there's a delay in response from the FMCS, please reach out to the FMCS leadership that's listed on our PowerPoint today. You can also reach out to our regional offices and to myself and to Monica Hariri, the FMCS program manager.
Great. In our sample, we note like the support broker's name, or you could do a signature. This person is noting that they didn't recognize the signature on the invoice. Can you talk about best practices and whether people should be signing their invoices that they're submitting?
Maybe I don't understand the question.
If you're creating in our sample invoice, should the invoice just note the name of the support broker, or should it also include their actual signature?
Both. So it should have the name, your name typed out, and then you should also sign the invoice, because that would be the support broker certifying that those services are providing and attesting to it. The signature is important.
Great.
Mm-hmm.
Okay, just going through some of these are duplicate. Okay. Another one was talking about the signature line. So again, can be added. It's an example and looking at best practices. Okay. We've gotten through those questions, so I'm just waiting for any new ones because we've addressed a number of these and we're getting some repeats that we've already addressed. Okay. So other questions related to the topic today of support broker invoicing. Another person wants to know again, can you submit invoices biweekly? Yes. The biweekly, actually it says, can support brokers submit invoices biweekly to the FMCS for the monthly service? Please note that support broker services are not a monthly service. Christy, you want to talk to that?
I mean, yeah, so, right. So support broker services, maybe I'm not understanding. Support broker services are provided as needed.
Right, and they can be billed on an hourly basis. If they're less than an hour, they would be rounded up, like we talked about, to the 15-minute increment based on at least 8 minutes minimally being provided. We're still getting questions about electronic signatures. There's different software tools that can be used that set up where you send it to the participant, they sign it, and then it goes directly to the FMCS. Can you address again electronic signatures?
I definitely can. What is particularly important is that if an electronic signature is used, that there is a way to ensure that there's not a conflict of interest, that someone else isn't the one signing. So I love this. I love the ability for the signature to go directly to the FMCS after it's signed instead of going back to the support broker.
Great. People are asking about a sample support broker agreement with the participant. Again, some of that is a business model that you would be developing. Christy, do you have any thoughts about support broker agreements, or something that maybe we could share in the future, an example of?
This is definitely something we anticipate sharing examples and templates of in the future.
Linda is asking again whether we would consider having support brokers use Bill.com for invoicing all FMCSs. Bill.com has a good tracking system. Can you speak to that?
I can. So Bill.com is a historical process that the ARC used. It's a direct deposit mechanism that the ARC uses. I'll just remind you that each FMCS has their own billing system and their own billing practices. So when a participant and their team chose an FMCS, they did choose the practice of that FMCS. All 3 FMCSs include a process for direct deposit for their vendors. So ensure that you're meeting with the participants you support and their FMCS as needed to get those details so that you can get direct deposit available to you.
Thank you. Christy, we're getting again some questions or comments related to if a support broker goes over 4 hours per month or exceeds the budget. Can you again talk about the importance of the team and the participant and the support broker all being on the same page in terms of the agreement of what services are being provided, the hours that are provided, versus just providing as many hours during the month, versus really coordinating that and being aware of authorization and budget allocations.
Definitely. So we don't, I think what I'd love to see and what I know to be best practice is when teams are meeting regularly all together with the CCS and the support broker, where we're able to discuss exactly what's happening for the person, because often support brokers have a more have a closer look at what's happening in a person's life and a person's team. And they might be billing more, they might be billing less based on what is happening. There might be some turnover in staff where support broker hours need to go over that 4, or things might be great and they are going under that 4. And the best way for everyone to know what's happening is for teams to be meeting regularly to go over that budget, where you can also do fewer budget modifications. So if you're in a place where you are a team has just overused support broker hours because everything that could have gone wrong has, the best way to stay on top of those things is to meet and to talk about what's going on and moving money sort of in a moving money in a like a informed way, so everyone knows what's happening if you're all meeting and talking about what's needed. I hope that's helpful.
Yep, thank you. Someone noted that there's been some delays in budget modifications by the ARC. Again, on the presentation slides, we've included the direct contact person for each FMCS. So if you've got concerns about budget modification delays by the ARC, please reach out to their customer service representative so that you can get support with that. Question about what happens if the support broker hours is a couple of months are over 4 hours, however, not over the support broker line amount. Just a reminder, under the Appendix K flexibility, there's the ability to provide over the 4 hours. Christy, did you want to add anything to that?
Yep. Up to 20 hours a month. What is really important is that people stay within their budget allocation. So in that example, everything would be fine if they're not over the line item.
Right. And just as Christy said, please remember to be working with the participant in the team and monitoring and communicating about needs and services. There's questions about what happens after June 30th. Please tune into our April 21st webinar on unwinding and the waiver renewal. And we'll just wait to see if we get any new questions. We're getting some thank yous. Appreciate the information and help. Question, can they access monitoring clients' budget with no access to the portal?
I would note again, the FMCSs are all working on allowing participants to grant access to their support brokers and CCS, their access to their portal. But in the meantime, I would really expect support brokers to be meeting with people and their teams to go over the budget and their own portal views, either virtually or in person. I'd really love to see that happening in most teams.
Great. A comment about a person may not be, a support broker may not be included in quarterly meetings with the CCS. Again, please work with the team and the participant. The participant is the decision maker and driver of services, so work with them if there's concerns related to that. There was a question about whether an email was sent out about the 421 webinar. Yes, DDA's sent out communication related to that. So you should see that in your email if you're on our email list. Question about, can you talk about how you could list times on your invoice if you add your time throughout the day to get a total of the time worked?
That's a good question. I really hope to be sharing more details on that soon and give some really great examples.
Great. Someone noted that some parents cannot or do not know how to look and maneuver the portals, or they don't know how to see the expenditures. Again, please reach out to the FMCS that's been selected by the participant for additional supports.
I can answer that, Rhonda.
Okay.
Is support broker billing billable? This is a great question. Absolutely not. Support broker services are a support to the person, and billing and preparing your invoice is a business practice. It's a part of your business expense.
Thank you. So as we're waiting to see if we get any additional questions, and thank you, great questions today. Just a reminder that we have recorded this webinar. It will be posted to the DDA self-directed dedicated webpage under the webinar section that's at the lower end of the page. It'll also include the posting of the 2 handouts so that you can grab them there if you'd like. The DDA will also be conducting this same webinar tomorrow for those individuals and that were unable to join us today. And so we'll again share the same information and field their questions and also post that recording. So we'll save last call for any questions today related to our focus topic.
Excellent. I will note that at the end of the webinar, you will receive a notice to complete a quick survey, 2-question survey that would be really useful for us. So if you could complete that out, we would be very, very thankful.
We're getting some comments to share this with participants. We have sent out communications related to the invoicing. It went out to all DDA stakeholders, so please feel free to also share that with people you support and the teams that you're on. Is tracking time considered a business expense? Yes, I would consider that a business expense.
If you're a vendor, all your tracking time and all of your mileage, all of that is all business expense. If you're an employee, it's different, but if you're a vendor,
Comment, but notes are not a business expense, I hope. Tracking notes. Christy, what's your thoughts on that?
I think I would like to know probably what notes you're talking about. If you've been directed by a person to complete notes for them, then it would be a service. If you're writing notes for your invoice, that's a business expense.
So again, I think thank you so much for joining us today. We really appreciate your time. We hope this information has been helpful. As Christy noted, as we close it, you'll get an opportunity to share some feedback with 2 questions. So we appreciate if you could share that with us and wish you well. We'll talk to you soon.